It's Sunday morning and I'm getting ready to go to work. My 6-year-old is in the other room, so if he comes in, I'm going to have to stop the camera because I don't want my kids on film. At least not yet. Probably never. Today, I wanted to just give you a quick update about what's going on with me with my health. It's not my health. My internal workings are fine. My organ systems are fine. My breathing is fine. I don't have a cold. I'm not sick. I have had pain for just a little over 10 months now. And being in the pain management industry as a profession, it's been very frustrating for me. Very, very frustrating for me. Because it does affect my work. This lipstick is so bright. It's crazy. I started with hip pain about a little over 10 months ago, and I tried to treat it as holistically as I possibly could. Being a holistic healthcare practitioner, I had a lot of avenues that I could go down. I did the chiropractic route, I did the herbal route, I did yoga, I tried to do strength training. That was pretty much impossible. I upped my cardio and that made it worse. What else did I do? I did massage, of course. What else did I do? I did go to a rheumatologist. I don't really know why. I thought that maybe it could be something. Anyway, I was the youngest person in his entire patient list, and all he wanted to do was give me narcotics and a cortisone injection. I wasn't willing to do that. That seemed too intense, too severe for me. He was he wanted me to be complacent with having the pain, and he didn't even recommend physical therapy or anything, which was kind of a bummer. I left his office very disappointed. I left it alone for a couple of months, and I ended up gaining a lot of weight. I ended up gaining some of the weight that I have now. Yeah, I've pretty much lost the weight that I gained because of the injury. I'm pretty much where I started because of the Metafast, which is great. But in 2014, I had made the decision that I was going to take care of my health. It was going to be a year of health for me, because being 41 years old, I had to get the mammogram, I had to do the whole thing. You know, I have to start really thinking about preventive medicine because I'm getting older and my children are, I need to be more and more active with them as they grow older. I need to go outside and play with them, and when I'm sick, they suffer, that kind of thing. So went and got the mammogram, went to the gynecologist, all that kind of stuff. But in the meantime, I did start investigating again different avenues for me to treat my hip. It's my right hip. Pain in the ass. It's not sciatica. It's from now this is going to get a little medical, from the sacroiliac joint in the back, but only on the right side, through the hip. It's the deepest weakness that I've ever felt in my life. It's truly at my core, and it's only on the right side. The only reason why it affects the left side is because it's just, the left side is picking up the slack for the right. And then it goes down into my quad, into my hamstring. I know all the names of all the muscles. I know everything that's going on. It's really frustrating. So I started in with another MD. She told me that I should try to take over-the-counter medication, anti-inflammatories. They do nothing for me. Aleve, Excedrin, Advil, Motrin, aspirin. The only thing that really helps is 3 extra strength Tylenol, which is not good. It's not good for your liver. It taxes your entire system. It's not something that I want to do. She offered narcotics. I said no. I'm not willing to do that. I don't want to be doped up all day long. Sure, narcotics are fun, and sure, with a glass of wine. But it doesn't help it. So why would I do that? Anyway, she prescribed physical therapy. I did physical therapy for 4 weeks. My physical therapist had less anatomy knowledge than I did. She knew nothing about my pain. She was prescribing exercises for me to do that completely exacerbated the situation. I was very disappointed in the physical therapist. I might have just gone to the wrong physical therapist, considering that my insurance sucks balls and I have to work within a network. Anyway, the physical therapy did nothing. She then prescribed me an MRI, which I got denied, but then she also referred me to an orthopedist. The orthopedist prescribed an MRI as well. That went through. And this past week, I got the diagnosis from the MRI. And it was the most frustrating diagnosis ever because I was thinking, well, okay, if it's a stress fracture, I'm off my feet, well, I'm on crutches for 4 to 6 weeks, and then it'll hopefully help. Which I don't even know how to be a mother of 2 kids and be on crutches for 4 to 6 weeks. I have no idea how that works, but I don't have to deal with that yet, so I'm going to get into that. Turns out that I have a lot of little things that add up to all the pain that I have, but each one of those little things cannot be fixed. I have arthritis at 41 years old, which sucks, which is probably directly related to the work that I do because I work on my feet and I work a very physical job. So I have arthritis. I have a benign tumor on the neck of my femur. They are both in the x-ray and in the MRI, they say it's benign. I don't know how they figure that out, but I guess because it's not vascular or something, I don't know, whatever. I have tears in my acetabular labrum, which is like the ball and socket joint. There's tears on the inside. So I have labral tears. The labrum is, just the cartilage. I said that already. What else is there? There's a cyst on my ovary that could be referring pain down. What else was there? There was a couple of other things. I can't remember. Oh, there was a swelling, slight swelling at the bursa. Just slight though, not enough to have been making this intense pain. So that's inflammation, that's fluid retention. And then all the musculature around it, both at the top of the quads and the top of the hamstrings, which is basically right at the hip joint, is inflamed. Not really inflamed. They said that it's, I don't know what they said, irritated or something like that. So all 5 of those things, I guess it's 5 things, all 5 of those things don't warrant anything. All he could say is we can give you a cortisone injection in your hip, and that has to be done radiologically, which basically they would have to put me under an x-ray machine, which I don't care because I'm not pregnant. I'm not planning on getting pregnant. I can't, whatever. I'm not afraid of the radiation. I'm afraid of the pain. I'm not afraid of needles. I'm afraid of pain with needles. I can watch blood being drawn out of my arm, but I can't. I get the idea of a 6-inch long needle going into my hip is frightening the fuck out of me. It's crazy. I can't even picture it. I'm only 41. I'm active. I'm healthy. What the hell, right? I said to the orthopedist, will that fix it? No. It'll make you pain-free for 4 to 6 months, maybe, and then you come back and you do it again. Being a holistic healthcare practitioner, hi. I'm in the pain management field, hi. I know that pain has a reason. Pain has a place in life. If you get rid of all pain, your body can't tell you what's going on. It's kind of like how a pediatrician and a vet treat their patients. Children, babies, and animals don't have language that we know of. So they have to deduce from the symptoms. If I take away the symptoms, I don't know if anything's wrong. I don't know what hurts it, what doesn't hurt it. I don't know. I know it's not a numbing thing. The cortisone injection, actually, it's a steroid, and it can get rid of inflammation within the hip joint. But the inflammation that they claim that I have in my hip joint is not a lot. It's not a lot. I'm getting a second opinion. Unfortunately, my shitty ass fucking health clinic couldn't get the referral through in time, so now I have to wait another 10 days to get an appointment with this other orthopedist because they were questioning the fact that I had already gone to an orthopedist and why should they write another prescription to another orthopedist. Because they wouldn't even let me talk to my doctor on the phone, which was really frustrating. Man, this video is a bummer. I am so sorry. I'm actually on my way out to work. I'm actually in a good mood today, but I just wanted to get this out because I had mentioned in a video like a week and a half ago that I had had an MRI, and I didn't know if anybody was wondering about this. Another reason why I wanted to start up this YouTube channel is because I'm probably going to be taking some time off work. I'm not going to be like, laying around eating bonbons, I wish. But I'm probably just going to be cutting my workload in half at work, which I'm so fortunate that I can do that because my husband works regularly. We're not loaded. In fact, we're kind of broke, but I can make it work. I'm a Virgo. I can make 5 cents stretch into $25. So that's cool. I can do it. But I just wanted to give you a heads up as to why it's also another reason why I started the MetaFast, because I feel like if I can drop 40 pounds, it's going to be so hard for me to do it with exercise. You know, if I can't get any cardio, if I can't work up a sweat easily, I'm going to have to try to figure out some exercise with upper body and with core that doesn't aggravate my hip, that I can actually do and work up a sweat with. You know, just mainly upper body stuff. I was actually thinking about YouTubing paraplegic workouts, because, you know, there's got to be a way for them to exercise, right? I mean, you know, from the waist up kind of a thing. And I'm not non-functional. I carry my massage table to people's homes, and I go like this all day long, and I'm cleaning my house, and I'm raising my children, and I mean, I'm functional. It's just, I'm in pain. I'm in pain a lot of the time, and it kind of sucks. It sucks that I'm the age that I am and I'm in pain. I know that something needs to be done. I'm just trying to figure out what it is, and I am being proactive. I know that people are going to watch this video and they're going to have all kinds of suggestions for me. That's fine. Whatever your suggestion is, chances are I've tried it. Chances are. I have not done acupuncture yet. I'm not afraid of needles. I just haven't had a chance to research a good one. That is probably my next step. I also want to try a third chiropractor. I've tried 2 chiropractors. They were very sympathetic to me, but they could not address the pain because it's too deep, and it's not an osteopathic pain. It's a muscular pain. It's very, very deep, and I thought it was, so I'm getting too medical, too technical. Wow, the lighting really changed, and this lipstick is still really awful. All right, it's Sunday. I didn't think I was going to be able to vlog today, but I did, obviously, right here. I don't know if I'm going to be able to edit it or upload it today. I'll probably end up uploading it late tonight or early tomorrow morning. I think I have a light day tomorrow. It's Monday, so I don't work. I don't, you know, physically, I mean, I don't professionally work on Mondays. I only, you know, I do the housewife thing on Mondays. Okay, I will talk to you later. Thanks for watching. Click like, subscribe, or that way. I don't know which way I'm going to put it yet, if I'm even going to put annotations in this. MetaFast Metallica Mom on Facebook. Come like me, come friend me, and we can chat. Thanks.